Hello, my name's Archie. I'm the pharmacist from Pinhoe Pharmacy. Today I'll be doing something on high blood pressure, but particularly using a meter, and at the same time I'd as well show you how to use a pulse oximeter, which is really popular at the moment. Obviously with high blood pressure it's really important to do something about it, because if there's too much pressure in your body, there's lots of delicate things that we need to protect, mainly our brain, our heart, our blood vessels, kidneys, our eyes. So bringing that down to a safe level is really important to prevent heart attack and strokes. And a lot of the time we might not even know that we have high blood pressure because you don't have any symptoms. Okay, so let's start from the beginning. So let's say the doctor asks you to get a machine. So you'll pop into any pharmacy to get a machine. So I'll take you from start to finish, from opening a box and to using it, etc. And obviously when you choose a machine, choose one that's clinically validated. What else? An upper arm one is going to be better to use. This one's got a 5-year guarantee, so this is a very good one to use. It also detects if you have an irregular heart. Okay, so let's have a look at opening one. So let's put the batteries in. So there's some instructions, obviously read that, really important. And let's just connect this tube to the machine itself. Okay, so you're almost good to go. So before we do it, ideally you would want to wait about 5 minutes before you actually use it. That way you're a little bit calmer. Make sure also, in this case my feet aren't touching the ground, but your feet need to touch the ground, and you've got something to support your back, which I don't have at the moment, but pretend that I do have my feet on the ground and something to support my back, so I'm nice and comfortable. As you can see here, my arm is about the level of my heart, and I'm going to put the strap here. I would have emptied my bladder so I don't feel like going to the toilet. That's quite important, and ideally you won't have eaten and you won't have had any caffeine for 30 minutes before. That way the reading's going to be slightly better. So it's quite an easy cuff, as you just saw me put it on, to use. Okay, so this tube here comes down the middle of my arm, and there's the crease of my elbow, and there's about, I can stick a finger in there, so that's about the right position for it to be. And I'm gonna pull that too. That's the Velcro. So here it's not too tight, so I can put my finger in here, and I can feel that I can put a finger in here, so that's good. As I said, the tube goes down the middle there. My arm rested on the surface, and I'm good to go. So I'm just going to, in a minute, just press this button, and it's going to slowly inflate, and I can feel the pressure in my arm. Ideally you won't be talking, although I'm talking over this, but you're not going to be talking, and you're just focusing on your breath and just breathing gently. So the first reading I would discard, because you can imagine if something's going to grab your arm, your body's going to react to that. So always disregard the first reading and take a note of the second and the third reading, and perhaps get an average of the second and third reading. Okay, so I'm going to do that again. So I've switched it off and I'm going to switch it back on again. It's going to do exactly the same. Now if there's an irregular heart rhythm that this machine detects, it will there's going to be a symbol on there that's going to show you. So that's one advantage of using this device here. So if I show you my reading, it's a bit high, but the circumstances are, I'm a bit stressed out. My feet aren't on the ground. I had a cup of tea, but anyway. So here it's 146/78. Can you see? And my pulse is 70. So what do those figures mean? Ideally, your blood pressure wants to be 120/80. I would say that would be normal or below. Anything up to about 140/90, perhaps it's getting into the pre-hypertensive stage. My pulse is 70, so as long as your pulse is less than 100, then that's all well and good, but that's quite individual to yourself. So knowing what your numbers are quite important. If it's going to be the first time you're going to use it, I would say in the first week, as probably your doctor sort of told you, you'd use it every day. You do it morning and evening, and as I said, the first reading you would disregard. The second and third reading you would use an average. So you can put those two figures down in the morning and evening, and you do it for 7 days. After that, what I would do is perhaps use it twice a month, and perhaps once a month. You'd only use it as, as a tool really, an indicator of where your blood pressure is. And obviously if, let's say, it is normal, all well and good, just carry on doing what you're doing. If it's on the higher side, the important things, don't worry, it's a bit of information. So what you can do is have a discussion with your pharmacist or your doctor, go on to NHS Choices, Blood Pressure UK, and get some information, because what you want to do is look at diet and look at your lifestyle, so exercise, etc., because all those things will be really beneficial to bring your blood pressure down. Okay, so that was nice and simple. Whilst we're on the subject of using a device, this is a pulse oximeter, which a lot of people are using at the moment, especially during COVID-19, etc. So very easy device to use. There's an on button here. So all I'm going to do now is just put this over my finger, and it's going to shine a beam of light through my nail bed. Okay, so I'm going to put that on my finger. Any finger's okay. And it's going to measure the amount of oxygen in my blood, and as you can see here, my oxygen sats are 100 and my pulse is very high. It's 89, so that's way high, but I was coming down to 79. It's coming down further to, yeah, that's good. So the oxygen saturation can range between 95 to 100, so that's the amount of oxygen in your blood, so that's good. And you can use that again as a tool to let you know if, let's say, you have a chest infection, or you're just not feeling so well. That gives you an indication of how well you're doing. And obviously when we have patients come in to see us, if they're not feeling so well, we get them into our consultation room, and we'll use this on them just to see where they are, and it gives us an idea of how things are with them. And that's that. Okay, thank you.